Hola a todos, ¿qué tal? Muy buenos días y saludos desde Washington, D.C. en los Estados Unidos. Gracias por conectarse a esta sesión informativa semanal de la Organización Panamericana de la Salud sobre la pandemia por COVID-19 en la región de las Américas. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y como todas las semanas esta sesión durará entre 45 minutos y una hora y estaremos tomando preguntas de ustedes hasta ese momento. Ya hemos recibido preguntas por correo electrónico y también podrán hacer sus preguntas en vivo y a través del chat mediante el botón Q y A. Les pedimos que nos escriban allí, así podemos coordinar las preguntas. Recuerden siempre incluir su nombre, apellido y medio de comunicación cuando nos envíen las preguntas por el Q y A. Les recuerdo también que contamos con interpretación simultánea al inglés, al español y también al portugués y al francés. Pueden optar por estas interpretaciones a través del botón Interpretation. Hoy la directora de la OPS, la doctora Carissa Etienne, les informará sobre la situación epidemiológica actual en la región de las Américas vinculada con COVID-19 y también profundizará sobre las variantes del virus que causa la COVID-19 y su situación en la región. Acompañan a la doctora Etienne, el doctor Jarbas Barbosa, subdirector del OPS, el doctor Ciro Ugarte, director del Departamento de Emergencias en Salud de la OPS, y el doctor Silvana Aldighieri, gerente de incidentes para COVID-19 en la OPS. Ahora sí, quisiera invitar a la doctora Etienne entonces para que comparta las palabras de apertura de esta sesión. Doctora Etienne.
Thank you, Sebastian. A very good morning to you, and let me thank you again for joining today's press briefing. This past week, the Americas reported nearly 1.6 million new cases of COVID-19, virtually half of all new global cases, indicating that we are still being heavily impacted by the pandemic. However, after many weeks of increases in COVID-19 cases and deaths, we are starting to see improving trends in some of the more heavily affected countries, including the United States and Brazil. There are also positive signs in Panama, Costa Rica, Chile, and Argentina. Now, this is cause for hope, but not yet for celebration. The number of COVID deaths continues to escalate across the Americas, a sign that many health systems remain overwhelmed, particularly in those places that carry a heavy burden of COVID-19 infections. Central America, especially parts of Honduras, El Salvador, and Guatemala, are reporting a rise in cases over the past 2 weeks, as is the Amazon region along the border between Brazil, Colombia, and Peru. The Caribbean is experiencing a significant rise in infections, particularly in the Dominican Republic, Cuba, Barbados, and St. Lucia. COVID transmission is very dynamic and affects countries and subregions differently, thanks in part to the control measures that we've put in place. But this is the nature of the pandemic. Transmission increases every time we let our guard down and disregard preventive measures that have been proven to limit the spread of this virus. A well-coordinated response that employs the full range of public health measures is still our best hope of stopping transmission in the short term. I know that there have been lots of concerns about the variants. When a virus circulates, it mutates and adapts. And this is not rare. It is an expected biological feature of viral outbreaks. The more a virus spreads, the more likely that variants will emerge. So it is not unexpected that a virus as widespread as COVID-19, which is circulating all over the world, has resulted in numerous variants appearing since the beginning of this pandemic. Most of these variants have very few implications for transmission or severity of disease. Occasionally, a few of these variants may change, and they may change how the virus behaves, and these variants must be closely monitored. We refer to these as variants of concern. And today I will address these variants of concern, sharing what we know about them and how we can monitor and address them in the Americas. Although some of the variants are commonly referred to by the place where they were first detected, like the UK, Brazil, and South Africa, their circulation is not restricted to these places. We certainly expect that the WHO will rename some of the variants to avoid stigmatizing the countries in which they were first identified. It's important to note that we have identified the three main variants of concern circulating in the Americas. At least 19 countries in our region have reported at least one variant of concern, although PAHO is analyzing and updating this data continuously. Evidence is beginning to suggest that some of these variants, such as the ones first detected in Brazil and the United Kingdom, may be more easily passed on from one person to the next, therefore accelerating a rise in COVID cases. While we don't yet have the full picture, it is starting to become clearer. Each new variant of concern must be monitored closely to detect any changes in how it behaves and spreads, and to ensure adequate measures are in place to control it. There is no reason for alarm, but for attention. And I want to emphasize three important points. It is important that our response to the pandemic be guided by evidence and not speculation. Let me say that again. Our response to the pandemic must be guided by evidence and not speculation. And that's why PAHO works closely with some of the best scientists in the world, many of whom happen to be based in our region. There are outstanding research teams working on the ground in places like Manaus, Brazil, who are focusing on this issue and providing us with information as swiftly as they can. Responding to the variants of concern requires widespread collaboration. So new information is quickly identified and responses can be adapted as required. And that's why PAHO's surveillance network is keeping a close watch on today's variants of concern and working closely with similar efforts around the globe. PAHO's regional genomic surveillance network has increased our ability to sequence virus samples by 50% since the beginning of this year. At least 11 countries in our region can sequence virus samples and detect the presence of variants. We also count on our two reference laboratories based in Chile and Brazil, which are receiving viral samples from across our region and supporting a network of national laboratories. We must stay focused in improving our capacity for surveillance so we can keep track of trends, including the variants of concern. So far, the evidence on these variants does not change the fundamental aspects of our pandemic response. Our recommendations to prevent this virus remain the same. uphold strong surveillance, limit gatherings, and practice social distancing, frequent hand hygiene, and mask wearing. All of these are still necessary and they do work against COVID-19 in all its forms. By continuing to adopt these practices, even after we are vaccinated, we can not only limit the spread of today's variants, but prevent new ones from emerging tomorrow. Let me finish by reminding you that PAHO is a strong believer in the life-saving power of vaccines. Based on the evidence that we have now on the variants of concern, we are confident that our growing portfolio of COVID-19 vaccines remains useful and will guide us through the end of this pandemic. Our trust remains unabated. We have at our hands a whole generation of effective vaccines to prevent infection and especially severe disease. Down the line, we may need to adapt our strategies, but we will continue to rely on these vaccines. The challenge now remains to ensure that these vaccines are distributed quickly and fairly across our region, starting with those who need them most. Over.
Muchas gracias, doctora Etienne. Vamos a pasar ahora a las preguntas y respuestas. Recuerden que pueden escribirnos nuevas preguntas a través del chat del botón Q y A e incluir su nombre y medio de comunicación. También recuerden que tenemos interpretación simultánea al español, inglés, portugués y francés. Hemos recibido varias preguntas con respecto a preparación de los países para empezar a vacunar y las preguntas en ese sentido de si están listos los países de la región que no lo han hecho aún para comenzar con la vacunación y cuál es su nivel de preparación para la llegada y el despliegue de las vacunas. Doctora Etienne.
So let me thank you for this question. PAHO has been supporting its member countries in their preparations to introduce the COVID-19 vaccines. And we have provided technical cooperation to help countries plan their vaccine deployment. We have distributed guidance documents, we have held training sessions, and we are giving the countries direct advice. We work with countries on their logistics to coordinate the delivery of doses and the monitoring of safety data, which is extremely important. We are also providing support with the recruiting and training of staff so that health personnel know how to deliver vaccines, and we advise them on public information campaigns to ensure that the people know where, when, and why to receive those vaccines. Let me inform you, thus far, some 31 countries of the Americas have provided information about their COVID-19 vaccine readiness through a tool that is called the Vaccine Introduction Readiness Tool, of VIRAT for short. And this is an online platform that is maintained by PAHO, WHO, UNICEF, and the World Bank. Of these countries, 21 have shared their national vaccination plan, and 20 have reviewed their cold chain equipment and procedures. The main challenges that were identified by countries relate to their information systems and not having sufficient trained staff. We have noted that 20 countries so far have evaluated their cold chain capacity to be able to handle these vaccines, as mainly those that require temperatures between 2 and 8 degrees centigrade. Now, this is really the same equipment that they regularly use in their immunization programs in maintaining the cold chain. I have made the statement, and I will say it again, our countries in the Americas have really very long, many years of experience in immunization, reaching coverages of over 90% of the target populations. And they have significant experience in doing immunization campaigns. So we are really helping them to boost that knowledge and that experience so they are ready to roll out vaccines immediately. Thank you.
Gracias, doctora Tien. En seguimiento también con este tema, la pregunta es de Cecibel Romero de Salud con Lupa, que le gustaría más información acerca de los planes de vacunación y los preparativos de los sistemas de refrigeración en la región, pero especialmente en El Salvador, Honduras, Guatemala y Nicaragua, que aún no arrancan con la vacunación, dice. Dice que quisiera obtener información más detallada sobre los informes que han entregado. Doctor Barbosa.
Gracias por la pregunta. Como informó la directora, la OPS, nosotros empezamos a apoyar a los países en la preparación de los planes desde marzo del año pasado, que fue el mes que enviamos las primeras guías sobre cómo empezar a preparar los planes de inmunización, porque no basta tener la vacuna. Hay que tener todos los otros aspectos, los aspectos regulatorios, la licencia de importación, la cadena de frío, todo eso que ha subrayado la directora. Entonces, estamos apoyando esses países. Los países están invitados a compartir sus dados por essa herramienta que foi mencionada, a herramienta Virate, que é pública e que é uma autoevaluação de mais de 100 aspectos de lo que es necesario para un país estar listo para la vacunación. Pero también estamos solicitando a los países que envíen los planes para la revisión de la OPS, de manera que se pueda perfeccionar, identificar brechas y apoyar. 31 países já compartiram suas informações em Virate, mais de 20 países já enviaram seus planos para a OPS para ter a revisão. Para os 10 países que são apoiados, ou seja, que vão a receber a vacuna por el mecanismo COVAX, sem necessitar pagar por la vacuna, e de los 4 países que a periodista mencionou, 3 estão neste caso. Ayer, esses países incluso tiveram que fazer o upload, né, fazer a entrega de seu plano de vacunação. E nós outros, como parte do Comitê Regional de COVAX, vamos a revisar todos os aspectos e fazer as sugerências e comentários para os países. Então, são países que estão, os países na região, incluso os 4 que você ha mencionado, sim, estão avançando com a preparação, porque isso vai ser clave para fazer com que toda a entrega da vacuna pueda ser em um sistema de imunização listo, con todos los aspectos que son necesarios. Muchas gracias.
Gracias, doctor. Me gustaría dar la palabra ahora a Roxana Tabacman, periodista científica de Medscape. Sí, Roxana, ¿nos estás escuchando? Tienes el piso.
Thank you very much. My question is, the ability to monitor viral evolution through sequences are not distributed evenly in Latin America, but the impact is a global one. So which is your recommendation as minimal monthly sequencing, for example, in the reality of Latin America today? Who should pay the bill because it's for everyone, the interest? And in a landscape of financial constraint, at what level should be prioritized because there is lack of money for all the necessities? And I have a second question. That is, which is your recommendation also for Latin America when a new variant of concern is detected for the first time? If there is any evidence of closing frontiers, and when I talk about frontiers, can be country frontiers, but also state or city, because there are many examples that the people is not allowed to go out of the city because a variant of concern.
Gracias, Roxana. Doctora Aldiguieri, ¿podría contestar?
Yes, Sebastian. Thank you. Thanks a lot for this set of questions. And there are many questions grouped in two groups, I would say. And as of first, Dr. Etienne provided all of us with a very comprehensive panorama and regarding how the genomic surveillance is important at this moment, at this time of a pandemic. I'd like to provide you with some more information, and also we'll try to address your concerns. As of 8 February, it means 2 days ago, 37 countries and territories in the Americas have published their genomes in a global platform which is called GS8. It's 113,000 genomes were published by these 37 countries, and it represents 20% of the global, the total of genomes published at global level. So this is important. The other aspect, repeating what Dr. Etienne said, the three variants of concern have been detected in 20 countries in the Americas. So the main goal of the regional network for genomic surveillance is to increase the geographic coverage of the surveillance, but also the number of samples that are sequenced among the many cases that are laboratory confirmed every week. This network, coordinated by PAHO, is accessible to all countries, but it's important to mention there are two groups. The first group is the countries that can do the sequencing themselves, and we have a set of recommendations for them. And the other group is the group of countries that can ship to one of the regional laboratories in Public Health Institute of Chile or Fiocruz Foundation in Brazil. It's important to mention that the US CDC is also assisting directly countries through its own country offices. So what PAHO is doing? PAHO is providing countries with, of course, technical guidance, but also with the reagents to do the sequencing and with the equipment for doing the sequencing. And it's also funding the shipment to regional reference laboratories. However, we are hopeful that the governments will assign more funding and fund both their own network when existing and their shipment, international shipment. But we remain available to the countries for assisting in these two aspects. So trying to answer your question, we see two levels of priority. The first level of priority is really ensuring a coordination, integration of a national network within the countries. For example, including integrating academic institutions, work all of them, all the labs in the same line, I would say, for doing the sequencing. But also linking closely the epidemiological surveillance systems and the genomic surveillance system with clear triggers for increasing the rate of sequencing. For example, when the incidence in one specific territory of country changes by 50% in a short period. So regarding public health measures in a context of variant of concern, and we have 3 on the table at this moment, reported in 20 countries and territories of the Americas. PAHO is asking the national and the local authorities, as well as the public, to continue their efforts in curbing the transmission of COVID-19, in implementing strictly the public health measures. All countries, provinces, states have developed their own guidelines and battery of public health measures. It's now a matter of collective discipline in implementing strictly these public health measures. Regarding travel-related measures, international travel-related measures, we are recommending to countries to have a risk-based approach. However, we are aware that in some situations, as land borders, the implementation is very challenging. The example of the tree border area between Brazil, Peru, and Colombia has been mentioned previously by our director. These are challenging environments, and specific measures in trans-border coordination should be implemented. I hope I have answered your concerns. Over.
Muchas gracias, doctor Aldiguieri. Siguientes preguntas vinculadas con Venezuela es en inglés y viene de Brian Earthworth, corresponsal de Reuters. También preguntan muy similar Nicole Chapur de Bloomberg y Mariana de Barrios de TV Venezuela. La pregunta en inglés de Brian Earthworth es I'm writing to follow up on the payment deadline for Venezuela to receive vaccines through the COVAX program, as announced last week by PAHO's Chief of Missions in Venezuela. We'd like to know if the deadline goes through the end of today, yesterday I think, and if there is a possibility that the deadline could be extended in order to give more time to reach an agreement. Doctor Barbosa, ¿podría comenzar?
Thank you for this question. The deadline of yesterday was the deadline for the countries that are AMC supported countries. These countries had until yesterday to upload their national deployment on vaccines plan to be reviewed by the regional committee, that is PAHO and other partners, and to prove that they are ready to receive and to deliver the vaccines. This is not the case of Venezuela. Venezuela is part of COVAX. We are in negotiation with COVAX because Venezuela should have made the payment already, but due to the difficult situation in Venezuela, it is taking more time, and we are asking for COVAX to have a flexible schedule to receive the payment when it is available, and to keep Venezuela as a self-financing country in the mechanism.
Gracias, doctor. Y una pregunta más relacionada con Venezuela viene de Kevin Arteaga del Carabonero y pregunta si las autoridades de salud de Venezuela han logrado aumentar la capacidad de diagnóstico con la aplicación de las pruebas de antígenos. Dice que hasta hace un mes solo habían aplicado 1% del total enviado por la organización. Doctor Ugarte.
Sí, muchas gracias por esa pregunta. Efectivamente, en este momento hay una evaluación en terreno en todos los lugares donde se colocaron los lectores y las pruebas. Y los datos preliminares indican que efectivamente se han estado usando en mayor cantidad. Por ejemplo, la cifra que tenemos hasta ahora es cerca de 10.000 de esas pruebas que se habían realizado entre el 1 de diciembre y el 5 de febrero. Es decir, estamos hablando de un incremento significativo en relación con la cifra anterior. Se están analizando varios componentes del proceso. Las facilidades de los laboratorios que están realizando la prueba, el entrenamiento del personal, aspectos logísticos, aspectos de la toma de prueba, aspectos de la diseminación de la información, de tal manera que se puedan hacer los ajustes para tener una información mucho más precisa y que estas pruebas se utilicen de acuerdo a lo que se había planificado. Gracias.
Muchas gracias, doctor. La siguiente pregunta es de Alina Dieste de AFP y hay varias preguntas también vinculadas con las vacunas de AstraZeneca también en el chat. Alina Dieste dice que la doctora Etienne acaba de reafirmar la confianza de la OPS en la cartera de vacunas y pregunta ¿a qué vacunas concretamente nos referimos? Dice, la vacuna de AstraZeneca, cuestionada estos días, representa la mayoría de dosis que se distribuirán a través de COVAX. ¿Qué valoración hace la OPS de la vacuna de AstraZeneca, en particular para luchar contra las nuevas variantes de la COVID-19 en la región? Y también pregunta, ¿qué mensaje puede darle la OPS a las personas que dudan de darse la vacuna de AstraZeneca? Doctor Barbosa.
Gracias por la pregunta. Nuestra directora, la doctora Etienne, está se refiriendo a todos los productores que han presentado propuestas para el mecanismo COVAX. Y además de AstraZeneca, tenemos a Pfizer, tenemos a Serum Institute de India, tenemos a Janssen, tenemos a outros produtores. La vacuna de AstraZeneca, hoy foi publicado a recomendação de uso del grupo estratégico de expertos de inmunización de la Organización Mundial de la Salud. Es un grupo que tiene expertos de todo el mundo y que hace muchos años el grupo que hace las recomendaciones para los programas de inmunización de todos los países. En esa recomendación se dice de manera muy clara, la vacuna de AstraZeneca es una vacuna que presentó una eficacia alrededor de 63% de una manera general, que foi identificado em África do Sul durante os ensaios clínicos que a vacuna estava sendo, em um número pequeno de pacientes, se detectou uma redução da eficácia para as formas leves e moderadas da enfermidade. Não há dados hoje sobre se essa nova variante que foi identificada em África do Sul pode cambiar a eficácia da vacuna para os casos graves, que é o principal objetivo da utilização. Pero quero subrayar, e a diretora, nossa diretora já ha chamado a atenção, esse hallazgo se tem porque, nesse momento, estava a vacuna de AstraZeneca com um ensaio clínico em campo, no terreno, em África do Sul. Não sabemos se outras vacinas também podem ser afetadas pelas novas variantes. Por isso, é necessário manter a vigilância e é necessário tomar todas as iniciativas para proteger as pessoas, para diminuir a transmissão do vírus, com o uso de mascarilhas, com manter distância física, evitar aglomerações e buscar ter mais acesso às vacinas. Essa é a melhor maneira de proteger. Estamos a buscar mais dados, o sistema global de vigilância sobre as vacinas, a buscar mais dados sobre as novas variantes e seus impactos sobre as vacinas, porque é uma possibilidade que pode ocorrer algum impacto de redução de eficácia em qualquer uma das vacinas. Então, em resumo, com os dados que temos, sim, a vacuna é uma vacuna eficaz, é uma vacuna segura, é uma vacuna que, com as informações que temos até hoje, deve continuar a ser utilizada. Essa é a recomendação do grupo estratégico de expertos em imunização da OMS. Gracias.
Gracias, doctor. Hay varias preguntas de periodistas vinculados todavía con esta vacuna. Ileana Cornejo, del diario El Mundo de El Salvador, pregunta si ya hay aprobación para AstraZeneca por parte de la OMS y si los últimos hallazgos de AstraZeneca podrían atrasar los envíos. También pregunta si hay fecha para el envío de dosis de vacunas de Pfizer a El Salvador.
Gracias por la pregunta. Mira, aprovación puede significar muchas cosas. Entonces voy a las dos situaciones que tenemos sobre una vacuna. Primero, una vacuna para ser utilizada en el mecanismo COVAX y poder ser adquirida por el Fondo Rotatório de la OPS, que conjuntamente con la UNICEF somos los mecanismos de adquisición de esas vacunas. Qualquer vacuna tiene que estar precalificada ou ter a autorização de uso em emergência da Organização Mundial de la Salud. A vacuna de AstraZeneca está bajo evaluação. Esperamos que a autorização de uso em emergência vá sair viernes ou el próximo lunes. Por que está essa avaliação, em verdade, é uma avaliação como se fosse para 3 vacunas, porque se está evaluando a vacuna de AstraZeneca, original, e os 2 sítios de produção de vacuna AstraZeneca que vão fornecer vacunas para o mecanismo COVAX. O produtor de Índia, que se chama Serum Institute de Índia, e o instituto em Coreia do Sul, que é South Korea Bioscience. Então, é um processo pouco mais complexo, porque você avalia a vacuna original e depois os outros 2 sítios, se todo o processo tem exatamente os mesmos estándares, a mesma qualidade, todo de maneira muito semelhante. Pero isso se vai concluir viernes ou lunes. Outro tópico é a recomendação de uso. Sim, a vacuna está recomendada, como hablei. O comitê SAGE, por seu acrônimo em inglês, o grupo estratégico de expertos em imunização, se reuniu lunes, revisou todos os dados e hoje foi publicada sua recomendação de que sim se deve utilizar a vacuna. E seguro que essa recomendação, como para qualquer outra vacuna, tem que seguir com monitoreio, com todos os dados da vida real, que está passando com a vacuna, qual é sua eficácia real quando se utiliza. Então, isso é necessário não só para a vacuna de AstraZeneca, mas para todas as vacunas que se estão utilizando, para que as recomendações se vão adaptando aos dados que necessitam. Recuerden que os dados de los ensaios clínicos e essa redução que foi detectada em África do Sul foi número muito pequeno de casos, muito pequeno. Então, há que ter mais dados para que se pueda, sobre a vacuna, qualquer vacuna que se está utilizando, ir adaptando as recomendações. Pero com os dados que temos hoje, sim, a recomendação é que se deve utilizar. Sobre as fechas, a expectativa é enviar para todos os países as fechas até o dia 15 de fevereiro. Então, os primeiros que vão receber a informação são os países. E seguro que os países, quando recebam a informação, vão compartilhar com os periodistas ao mesmo minuto. Então, quando vamos a informar, quando os países tiverem a informação, vão compartilhar. O mecanismo COVAX vai informar a cada país a fecha, a quantidade que vai receber, para que os países possam adaptar seus planos de imunização a esta disponibilidad de vacuna. Gracias.
Muchas gracias, doctor. Tenemos una pregunta de Lucía Sol Miguel del diario La Nación de Argentina. Si nos escuchas, Lucía Sol Miguel, te estoy dando el piso.
Sí, muchas gracias. Me gustaría saber qué dificultades presentan los refugiados y los migrantes en cuanto al acceso a la vacunación en la región. Gracias.
Gracias, Lucía. Doctor Ugarte.
Gracias, Lucía. Es una pregunta muy importante porque en nuestra región hay millones de migrantes. Y quisiera empezar mencionando que los migrantes responden a la generosidad de los países con beneficios económicos, sociales y culturales. En ese sentido, uno de los problemas principales que enfrentan los migrantes es su regularización en cuanto a su situación legal en los países, lo que en muchos casos le permitiría acceder a los servicios de salud y, por supuesto, eventualmente a la vacuna para la COVID, dependiendo del grupo prioritario al que pertenece. Muchos de esos migrantes trabajan en el sector salud y muy probablemente van a estar incluidos en la primera fase de la recepción de la vacuna. Sin embargo, hay muchos otros que están en el área informal y no solo no podrían recibir la vacuna debido a que no han sido detectados adecuadamente o no están en la planificación, o algunos de ellos quizá prefieran no ser identificados por varias razones. En ese sentido, esa es una de las dificultades mayores. El otro es en relación con la disponibilidad de vacunas para los propios países y para las poblaciones prioritarias de los países. En ese sentido, los países que reciben mayor cantidad de vacunas van a tener mayor probabilidad de incluir a los migrantes, sea porque los países, la mayoría de los países en la región de las Américas, quisiera mencionar, tienen provisiones específicas y normas específicas que incluyen a los migrantes en eventos de epidemias o de programas regulares de vacunación. Y otros que no lo incluyen han tomado la decisión de incluirlos porque es una medida adecuada para controlar la pandemia en los países. En ese sentido, es muy importante resaltar la generosidad de muchos países de la región y el anuncio que hizo el presidente Duque de Colombia de regularizar la situación de los migrantes venezolanos. Es un paso muy importante para que ellos tengan acceso a servicios de salud, pero también que tengan acceso a trabajo y a todos los elementos de la vida cotidiana y que puedan contribuir a la economía también. Pero esto es un proceso constante, es una abogacía de muchas agencias de Naciones Unidas y de los propios países que están viendo el acceso de vacunas a los migrantes como una medida de controlar la pandemia al interior de sus países y un factor de equidad también. Gracias.
Gracias, doctor. En inglés, Alia Briggs from CBC News. Alia Briggs, I'd like to give you the floor to ask your question if you are listening to us.
Thank you, Sebastian. So in light of recent data, which indicates that the AstraZeneca vaccine provides minimal protection against new variants of COVID, a number of Caribbean countries, particularly here in Barbados, we've received 100,000 doses of this vaccine. In light of that, should our public health authorities reevaluate the vaccination rollout strategy? Or would you say that it is safe for the public to receive these vaccines, although there's a chance that you could still get the virus?
Thank you, Alia. Dr. Barbosa?
Thank you for this question, Lydia. But first, let me correct the information that you provided. It's not true that the AstraZeneca vaccine showed the significant reduction for the variants. No, this is not correct. The correct is that during the phase 1, phase 2 clinical trials in South Africa, in a small number of participants of this trial was detected a reduction in the efficacy for mild and for mild cases, mild and moderate cases only. We don't have enough data about the efficacy implications for severe cases, for instance. And this was only for the variant that is circulating in South Africa. We cannot expand this to all the other variants. It's not the correct way to approach this problem. So as I mentioned before, today, the strategic advisory group of experts on immunization of WHO released their recommendation. You can go online and see it's very detailed information about this in a very transparent way. But with the data that you have so far, the SAGE group is recommending the use of the AstraZeneca vaccine because we need more data to confirm if there is really a decrease in the efficacy in real life, not only in a small number of patients. And second, this decrease was experienced in mild and moderate cases. We don't have evidence showing that the efficacy was reduced for severe cases, hospitalized cases, and deaths. So the recommendation is to use the vaccine to get more data, not only for these vaccines, but for all other vaccines that can be affected by the new variants. So we need to keep vaccinating and at the same time collecting more data and to see what is the real effect of these new variants on the vaccine efficacy. Thank you.
Gracias, doctor. Las siguientes preguntas vienen de Krupskaya Alice, corresponsal en México de CNN en español, y también de Nurit Martínez de El Sol de México. Dicen que la Universidad Johns Hopkins dio a conocer un estudio que ubica a México con la mayor mortalidad por COVID-19 en el mundo y pide un comentario sobre las políticas llevadas adelante y qué sugiere la OPS para reducir la mortalidad. Doctor Aldiguieri.
Sí, gracias por esa pregunta de CNN México y otro colega periodista en México. Primero quisiera destacar que México notifica de manera diaria sus casos y fallecidos como requerido bajo el Reglamento Sanitario Internacional. Y en nuestras bases de datos, de hecho, México está en el tercer lugar del número acumulado de fallecidos reportados en la región de las Américas, después de Estados Unidos, que tienen un acumulado de más de 461.000 fallecidos, Brasil con más de 232.000 fallecidos, y México con un acumulado de más de 166.000 fallecidos. Se ha detectado en México un repunte de casos con un pico en semanas anteriores, mejor dicho, con un pico durante la tercera semana de enero 2021. Y lo que estamos observando en este momento, que aún el número de nuevos casos a la fecha de hoy, esa semana epidemiológica, tiene una tendencia que baja durante los últimos días, los datos de mortalidad son estables. Pero tenemos que tomar en cuenta que, como conocido desde el inicio de esa pandemia y el más conocimiento sobre este virus, existe una diferencia de 3 semanas o más entre la curva de nuevos casos y la curva de los fallecidos. Es importante mencionar también que el repunte detectado desde enero de este año ha afectado en la mayoría la zona central del país, que es la más poblada, con el Distrito Federal, el Estado de México y otros estados, y ha provocado una saturación de servicios hospitalarios con una llegada tardía de casos graves ya complicados en servicios de cuidados intensivos. Nuestro equipo en México trabaja directamente con la Secretaría de Salud y los estados para mejorar la detección temprana de complicaciones en pacientes que todavía están en la casa o que son atendidos en unidades de atención primaria, para su orientación rápida hacia servicios de más alta resolución. Adicionalmente, se está trabajando a través de nuestro equipo país en el mejoramiento de la cadena de provisión de oxígeno médico, que ha sido un desafío importante en algunos territorios de México. Espero haber respondido a su pregunta. Gracias.
Muchas gracias, doctor. Tenemos varias preguntas de Chris Vilches, periodista de Zona Lima del grupo El Comercio en Perú. Dice, ¿qué avances hay con el acceso a vacunas contra la COVID-19 mediante COVAX por parte de Perú? ¿Y cuándo se va a firmar el contrato para el acceso de las dosis de Pfizer y AstraZeneca? También pregunta cómo recibe la OMS el inicio de la vacunación en Perú con las dosis de Sinopharm. Doctor Barbosa.
Gracias por las preguntas, Cris. Primeiro, como já hablamos al principio, solo para recordar, o mecanismo COVAX enviou uma carta para todos os países do mundo, os mais de 190 países que participam do mecanismo, com a primeira estimação sobre as doses que vão receber no primeiro semestre. A fecha exata de quando empieza a chegar as doses vão ser enviadas para os países até o dia 15 de fevereiro. Peru participa do mecanismo COVAX e Peru foi dos 4 países da região selecionados por el mecanismo COVAX para uma iniciativa que se chama Primeira Ola. Essa primeira ola é uma quantidade pequena de doses de vacuna de Pfizer que devem ser utilizadas para os profissionais de saúde. Então, com determinados critérios, foram 4 países da região, 2 países que são países de AMC, suporte, que países que vão receber o apoio del COVAX, ou seja, que vão receber a vacuna sem necessitar pago, e 2 países de autofinanciamento. Os 2 países de autofinanciamento são Colômbia e Peru. O critério que foi utilizado, bajo a indicação de um comitê independente de expertos, foi de utilizar a taxa de mortalidade nos últimos 28 dias como um proxy do risco que têm os profissionais de saúde. Então, Peru vai receber essa vacuna Peru ha confirmado que tiene capacidad, es una cantidad pequeña también, de vacunas de Pfizer. Peru tiene la capacidad para almacenar essas doses de vacuna e devem estar a receber hasta el dia 15 de fevereiro la informação para essa primeira ola. Também Peru vai receber, ao final de fevereiro, princípio de março, as doses correspondentes de la entrega normal del mecanismo COVAX. E como falei, a fecha, os países vão receber essa informação. É uma logística complexa, porque são mais de 190 países. Temos, desafortunadamente, vuelos que foram cancelados, mas estamos trabalhando muito, nós outros da OPS, o Fundo Rotatório da OPS, com a Unicef, para ter toda a estratégia de distribuição das vacunas de nossa responsabilidade para os países das Américas, lista para que possam receber a comunicação. A decisão de Peru de utilizar a vacuna de Sinopharm é uma decisão do país, cada país tem sua soberania para decidir que vacunas vai utilizar, e seguro, o que é importante é que o país pueda compartilhar com a população todas as informações sobre os processos regulatórios que han adotado, qual é a base para a decisão, pero nós outros não hacemos avaliação sobre decisões individuais de los países. A vacuna de Sinopharm foi oferecida também para o mecanismo COVAX, está bajo processo de avaliação. Sinopharm e Sinovac, os dois produtores de China, solicitaram o acesso ao mecanismo COVAX. A Organização Mundial da Saúde enviou uma equipe de inspeção para a China, que passou já mais de uma semana evaluando as duas plantas, e esperamos que a decisão sobre a pré-qualificação ou autorização de uso de emergência para a Sinopharm e a Sinovac vão a sair a princípios de março. Então, hasta esse momento, nós outros não temos condições de enviar de dizer uma opinião, pero seguro que cada país ha adotado sua decisão com base em informações que foram brindadas por los produtores. Gracias.
Gracias, doctor. Y en inglés, Steven Cirilien de PGD2 Radio pregunta en San Martín, many persons in the region are skeptical about taking the COVID-19 vaccine. How do you convince people that taking the vaccine is the right thing to do? Dr. Barbosa?
Thank you for the question. I think that this is, sometimes we are surprised to see that in 2021, after so many decades that the vaccines have saved millions of lives, we still have to answer this question, but it's very important that you raise this up, because many people now not only in the Americas, but in the world, are making the same question. First, it's important to say that the vaccines that we have now for COVID-19, they are the outcome of an unprecedented movement of producers, biotech companies that develop vaccines using many different technological platforms. These vaccines, they benefited from other researchers for other coronavirus and other viruses that have been researched in recent decades. Second, the vaccines, to be approved, they needed to show the evidence to the regulators in each country and to WHO to receive the pre-qualification or the emergency use list authorization. They need to show the evidence that the producer has good manufacturing standards. They need to show that they have performed the clinical, preclinical, and clinical trials, phase 1, 2, and 3, that their vaccine is safety and efficacious. So there is no different approach to these vaccines. All the regulators and WHO, they are trying to have more expedited processes, but all the dossiers of the producers are being reviewed carefully, thoroughly, to release the authorization only after we have the confirmation that these data are sound, that these data are showing that the vaccine is safe and efficacious. So I think that it's very important to also to respond to some myths. Some people are saying that the vaccine has a microchip. This is kind of a conspiracy theory, but unfortunately, some people that don't have access to media vehicles that are only receiving information from their friends on social media, they need to be aware of the danger that this kind of misinformation or that vaccines can change your DNA. This is not true. Absolutely, it's not true. So I think that it's very important, and we are highlighting the crucial role that the national authorities, the Ministry of Health, need to have this permanent dialogue using the social media, the media vehicles, the newspapers, TV, radio, all the instruments that we have to tell the population how the vaccines are developed, produced, how we can access their safety and efficacy. And I think that responded to all the questions that some people have. We have a small group of people that are against vaccine, but this is a small group. But we have, I think, that an important group that has doubts about the vaccine, that wants to receive more answers. So it's very important. We, here at PAHO, we had 2 workshops for journalists, specifically to tell them the whole process to produce and to approve a vaccine. And we encourage you to ask the Ministry of Health, also specialists, the scientific community. So I think that is very important to bring all the information we have, because vaccines have saved millions of lives since in last century, in the first decades of this century, and the vaccine is the best way that we will get the full control of the pandemic. So it's very important to show the data, the evidence, to have in a very transparent way to convince the communities, families, and people about the benefits that the vaccines will provide to them. Thank you for this question.
Muchas gracias, doctor. Una pregunta más llega de Kadim Joseph from Observing Media en Antigua en inglés. Pregunta, is there any advice for countries like Antigua and Barbuda with limited resources who are in the middle of a major spike in cases? Doctor Barbosa, si usted podría contestar quizás.
Yes, no, thank you. Thank you for this question. This is important because even countries that have started the vaccination, the vaccine is not a silver bullet. The vaccine will not stop the transmission next week. So probably we will face months ahead of us that while we are getting more vaccines and to have more people vaccinated, we need to keep the measures that we know. We have now tons of evidence showing that wearing masks, keeping physical distance, avoiding closed and crowded spaces are a very efficient way to prevent the transmission. So this is I think that the general recommendation, of course, that every country needs to monitor the situation, because sometimes you have in a country, one city is the situation is relatively controlled, but in other city, the cases are increasing. So this is important also that the health authorities in each country need to monitor. But again, we expect that we will have to vaccinate at least 70% of the population to achieve collective community or herd immunity. to control the transmission. So we are not talking about the days or weeks. We are talking about months. So let's keep all the measures that we know that can prevent in order to these measures working together with the vaccines achieve the reduction of the transmission and in the near future, the control of the transmission of COVID-19 pandemic. Thank you.
Gracias, doctor. Ahora sí, estamos llegando al final de nuestro media briefing y hemos recibido varias preguntas sobre vacunas y lo que está haciendo la OPS, y justamente la pregunta es, ¿qué está haciendo la OPS para acelerar la llegada de las vacunas a la región de las Américas? Doctora Etienne.
Thank you for this question. So let me begin by explaining that in Latin America and the Caribbean, we will need to immunize approximately 500 million people to be able to control the pandemic. Some countries have already begun purchasing vaccines directly from manufacturers, and they have begun their vaccination programs. Because we foresaw the possible lack of equity in accessing vaccines, because we knew that there would be some production issues everywhere, COVAX was formed. And COVAX is a coalition that is led by WHO and Gavi, and has set the initial goal of providing vaccines for at least 20% of the population in each of its participating countries. Now, there are 37 countries in our region that are participating in COVAX. And COVAX, as you would have listened from Dr. Barbosa, COVAX has signed purchase agreements with AstraZeneca. There are a basket of vaccines that they are negotiating with and looking to have agreements. Countries in our region will start to receive deliveries of vaccines by the end of this month to protect the populations who are most at risk from severe forms of COVID-19. Of course, this includes healthcare workers, older populations, and persons on the front line. So in Latin America and the Caribbean, 37 countries will receive vaccines through COVAX. And of that 37, 27 are purchasing with their own financing, and 10 of them will do so at no cost to the economic condition, due to the economic condition or their population size. Now, these doses and the availability of vaccine under COVAX are still subject to the emergency use listing by WHO. Of course, the manufacturing production capacity, as well as establishing the supply agreements between the producers, PAHO, and UNICEF. Our PAHO revolving fund with UNICEF are the purchasing mechanisms for COVAX. But PAHO is also beginning to explore how could we assist countries in terms of the other percentage, was it 50%, is it 60%, to achieve herd immunity, and through the revolving fund to make those accessible to countries. Of course, PAHO and WHO and our Director General is really very concerned about the lack of equity in terms of access to vaccines. And we are approaching this on many fronts. Our Director General is having discussions with many of the very high income countries and to see how they can contribute to COVAX and to ensure that all countries have some reasonable access to vaccines. But I want to re-emphasize the last point that Dr. Barbosa made. Vaccines are not going to solve our problems immediately. And so we have to do everything that we can to reduce the circulation of the virus. And to do that, we have to use the proven public health measures, and which includes staying at home when possible, wearing masks, social distancing, and washing your hands frequently. And governments will also have to ensure that their public health measures are also beefed up in terms of identification of cases and quarantine, etc. That they take the measures that are necessary to help to protect the population. So this is our call out to you. Please do not let down your guard. Continue the public health measures as we await vaccines, but even when we get vaccines, we will simultaneously have to reinforce our public health measures. Thank you for being with us today, and we'll see you next week.
Muchas gracias, doctora Etienne. Ahora sí, hemos llegado al final de la sesión de hoy. Vamos a compartirles por aquí la página web que les mencionábamos sobre VIRAT, sobre la herramienta de preparación para la introducción de vacunas, que tienen los datos de preparación que están informando voluntariamente los países de la región. Esta plataforma mantenida por OPS, OMS, UNICEF y el Banco Mundial. Ahí pueden encontrar más datos. En breve les estaremos enviando las palabras de la directora y pueden recibir más información, encontrar más información como siempre en nuestra página web en www.paho.org/coronavirus. Recuerden que pueden seguir en contacto con nosotros por correo electrónico y bueno, muchas gracias nuevamente por acompañarnos y nos encontramos nuevamente el próximo miércoles. Saludos a todos.